I'm Dutch, and let's react to the Americans. Hello, and welcome to my channel. My name is Johan, and I'm a typical Dutchman. And if you're planning to leave the US and coming over to Europe, or if you're wondering, why is the US so very expensive comparing to Europe, then you are at the right channel, because I'm looking at life and living in the US and in Europe and comparing them and pointing out where are the differences so that you can make a good decision if you want to stay or leave the US. And for today, I'm going to take a look at the video that's called How the US Healthcare System Currently Works and How We Got Here, by Peter Attia and Saum Sutaria. Two names who don't say anything to me. Says, I'm just seeing two guys talking to each other about how the healthcare system currently works. So I'm curious, because my opinion is, yeah, how this system is not working. But let's see what they have to say. If you like this kind of content and reacting to, then please consider to subscribe to the channel and like the video. So let's take a look at what this is.
Saum, we're going to talk about the things that people care about, right? Which is, why is it so expensive? Why isn't everybody covered? Why do we not have the best life expectancy? In fact, on average, why do we have horrible life expectancy despite spending twice as much as anybody else? But
yeah, okay. Kicking off with a lot of questions. That's good. Then we're going to have the answers. But it's all about the healthcare. It doesn't start with that. But I assume this is talking about the healthcare.
We can't have that discussion if people don't understand the system. And that gets to kind of what I just said a minute ago. It's a really complicated system. You're one of the most structured thinkers I know of. So I'm going to actually just defer to you as to what framework do you want to put to this for people to understand how so many trillions of dollars flow in, so many trillions of dollars flow out, who's paying, who's receiving, how is this thing organized, and why are we different?
Interesting. I want to know too, because there's a lot of money going in, but it's not going to people who actually need those healthcare.
Than every other country on the planet.
Yeah, let's.
How is this thing organized, and why are we different than every other country on the planet?
Yeah, why are we? Good question. A couple of good questions. I want to know what the answers are.
Yeah, let's start with how the system works from a financing perspective. And then I think we can talk about how that's different than other countries. We can talk about the impact on outcomes, and we can probably even start to set up the framework on, as you say, the things people are interested in, why, and what can we do about it. But it's hard to start anywhere other than, this is now close to 20% of the U.S. economy, healthcare, 17, 18% currently. But
let's give a number to that, because that is people don't understand how big the U.S. economy is. So
yeah.
20%, 1/5 of the economy is about the healthcare system.
Dollars are we talking about?
Yeah, we're talking about a U.S. economy, gross domestic product, that's probably $28 trillion.
GDP of $28 trillion.
Okay.
That's 20% of the world, 20 to 25% of the world's economy.
With about 7%, right, or less of the, yeah. And another way to think about that's almost...
Wait, 7%, almost a quarter of the entire world's GDP, a quarter of that is in the United States? Is that what he said?
It's 20% of the world, 20 to 25% of the world's economy.
Yeah, 20 to 25%.
With about 7%, right, or less of the, yeah. And another way to think about that's almost $90,000 per person in the U.S.
GDP, 90,000. Okay.
Okay. We spend $11,000 to $12,000 per person in the U.S. on total healthcare expenditure. Just to put that in context, $4 trillion.
What? I hear these numbers. What?
Okay. We spend $11,000 to $12,000 per person in the U.S. on total healthcare expenditure.
11 to 12,000 per person on,
just to put that in context, $4 trillion of expenditure in the healthcare sector. If you added up all of the exports that the United States sends out across all industries, you're talking about $3 trillion. We import more than we export. We're a consumer culture. That's close to $4 trillion, but not quite at $4 trillion today. I mean, you just put that in context in terms of how much we spend in healthcare in the U.S. It's
speechless. Hearing this total import and export of the U.S. income expenditure is less than the money that is going around, let's say, in healthcare.
It's a huge number. And I appreciate the comments about, how healthcare as a topic waxes and wanes with respect to being top of mind. But any discussion about the economy, about inflation, about jobs, you're really talking about healthcare in many ways. It may not be as direct as talking about healthcare policy, but you're really talking about healthcare, given that it's almost 20% of the economy. And
yeah, closing a hospital means losing jobs, but
there's no escaping that.
Do we know that it represents roughly 20% of the workforce as well?
Well, it probably represents, in terms of wages, a little bit more than that, because the average wage in healthcare is higher than in other areas. And this is something that, as we get into how you think about the future, we should talk about, because as healthcare as a percentage of the U.S. economy grows, you can't have that happen without considering what it does to the rest of the economy. And that's going to be an important discussion around U.S. competitiveness, U.S. affordability, U.S. coverage, et cetera, given the nature of healthcare and healthcare issues today. So
do you think it makes sense, Saum, and feel free to shoot this idea down, does it make sense to go back to the 1950s to start with Hill-Burton, to start with, and then progress into Medicare and Medicaid? Like, does historical context give people a sense of, like, what happened after World War II?
Yeah,
what did the United States look like?
Because I think...
Okay, let's go back to after World War II, 1950s.
I think, and we can do it quickly and give people a sense of what happened, but let's just start with painting the picture of where we are today, and then let's back up and say, how did we get here? Okay, so $4 trillion. And again, just to keep this simple, about $1 trillion of that, okay, 1/4, comes from consumers. Now, some of that is spent in, you and I both would contribute to the insurance we procure. And some of that, we're directly consuming healthcare by spending money on healthcare services out of our pockets. But think about it as 1/4 or $1 trillion. Employers put another $1 trillion into the system. So how do they do that? Largely through employer-sponsored insurance. So that's the second $1 trillion. So now you've accounted only for half of it. So where's the other half coming from?
Yeah, okay. Your own health insurance, your premium, and your out-of-pocket costs, and the other half, the other $1 trillion is when your employer does this covering for you.
The other half is coming from government, federal government and state government. These days, a lot of it is federal government. And the federal government contributes in two different ways: direct expenditures, and as we'll get into when we start talking about history, employer-sponsored coverage being the dominant source of coverage is unique to the United States, right? Which is that your employer procures health insurance for employees, which then provides a form of coverage. That's relatively unique as a mechanism of coverage.
And let's make sure that people appreciate that, because someone listening to this might say, "But I have a health insurance card and it says Blue Shield on it. So doesn't Blue Shield provide my insurance?"
I would say yes.
That's correct, but it's coming through your employer, and most people would recognize that because of their annual enrollment, right? So they're picking Blue Shield or Aetna or Cigna or United, or, if they're in a Medicare plan, they may be looking at Humana or other Blues plans from
But the
standpoint.
point is that the Humana, the Aetna, the whoever is on the card is usually providing an administrative service only if the employer is large enough that the employer is bearing the risk, which maybe we'll get into that. Maybe we should explain that a little more deeply. Okay.
So you've got a fourth that people are spending out of pocket in one form or another. Some of it, of course, to subsidize their ability to buy insurance. A fourth that's coming from employers directly, right, out of their profits. Now, think about that $1 trillion for 1 second. Total U.S. corporate profits are about, interestingly, coincidentally, just south of $4 trillion.
Really?
So corporate profits, okay, post-tax. So the expenditure in healthcare is pretty significant, right, when you think about it that way. Now, off of total revenues, of course, it's a lot lower as a percentage. But if you think about it from the perspective of total corporate profits, that's a big number. The U.S. consumer spends, you should think of it this way, for that $1 trillion, it's about, if you have a $20 bill, $1 of that is going into direct healthcare expenditure, like 5%. Of someone's expenditure in an annual average basis. Okay, and then you've got the government. The government's spending about $2 trillion. Again, it's direct spend plus there's tax subsidy for employer-sponsored insurance. We'll get into that because that's a unique feature.
Yeah, it's already confusing because he's talking about a lot of numbers, but if I'm looking back to Europe, there is not that much out of pocket. There is no out of pocket unless you choose for it. And the government is paying the rest. And the employer is required to pay also a part of your health insurance. So it's not that they buy the health insurance and give it to me or you. No, they have to pay in on the health insurance that you have chosen for yourself.
When you talk about 1950s, 1954, the tax benefits for providing employer-sponsored insurance were codified into law.
By the way, going back to that $1 trillion that employers are spending, that is a pre-tax benefit basically to employees.
And that's the incentive. And that's the incentive that started back in 1954, which is that giving people health care coverage through group purchased insurance by your employer is a pre-tax benefit rather than a post-tax benefit. So it created an incentive for employer-sponsored insurance to grow and now, of course, ultimately become the dominant form of which people procure insurance today outside of government.
What's the
Okay. Yeah. Okay. But I'm still not, because these are huge numbers.
approximate cutoff in company size at which point it makes sense to self-insure, which is what you're describing?
Oh, I think it's, I mean, to your point, it's mostly larger companies that do that. But, you know, the definition of large isn't that large. I mean, there are entities.
500 people?
Yeah, there are entities with less than 500 employees that self-insure at times. Not that common, but certainly as you get above that level, it makes sense.
Okay.
Now, you let's for a second put the federal spending in context, right? I mean, close to, with the direct and the tax in-kind contribution to healthcare that the federal government is making, you're getting close to $2 trillion, $1.82 trillion. Defense spending, let's just put that in context. That's about $1 trillion. Social Security, $1.2 trillion.
And to be clear, Social Security doesn't come out of tax revenue directly. That's
correct.
That's prepaid. The number that I keep thinking of, Saum, is the government collects $5 trillion a year in taxes. That's the government's income, is $5 trillion. And we're putting 40% of that right back into healthcare, if I'm understanding this correctly?
Well, yeah, I mean, we that may be
And the other 60%? Military?
What we collect, but obviously the government is spending closer to 6.8 trillion or something like that.
That's right. There's a trade deficit.
Yeah, there's a deficit.
There's a deficit.
Yeah.
So this is the other thing that we were talking about the other day that just blows my mind, which is we collect $5 trillion a year, we spend $7 trillion a year, so we have
Here's a huge deficit.
a deficit of $2 trillion a year in perpetuity. Oh, and by the way, we're sitting on $35 trillion of debt.
Total debt.
We're going to come back to this point in a minute. I'm going to borrow from Paul Tudor Jones on his very eloquent explanation for how do you put that in context.
Yeah. No, and that, I mean, ultimately, that is, I think, the question when healthcare is such a large part of the economy, how sustainable is it what we're doing in healthcare expenditure?
Yeah, that's a good one. Because if the prices rises every year and there is no cap on it, somewhere, somehow, it's becoming, unpayable.
So, look, you take all that money and financing, and then in the U.S., there's a system that it goes into, right? You got $4 trillion, a quarter and half from government, and you're flowing it into a system. And in our system, about $2.5 trillion of that, plus some from the government, is flowing into private insurance, okay? They're covering, what we would traditionally call commercial insurance, but the private insurance community is also covering a bit of Medicare and Medicaid, increasingly large proportions of that.
That's through programs like Medicare Advantage and things like that.
Medicare Advantage or Managed Medicaid or other things like that, that allow for theoretically better choice, better benefits and other things, and maybe even cost control. And then there is a retail component. And then obviously the government does pay directly to providers through Medicare and Medicaid some amount of money, and that's about $1 trillion. So the split and flow, you can break it down pretty simply from that perspective. Look, when I look at how the money's spent in a way that people can understand, I think of very simple rules. We'll get into this, which is...
Yeah, but we're getting into this. He's making more and more up of it and doesn't give the right answers. Man, we got 2.5 minutes left in this clip. It's not good.
Administrative cost in the U.S. is probably one of the biggest gaps to what we see in the rest of the world. And that can be good or bad. You have to make a judgment about whether all that administrative spend is creating a better system with more choice and better outcomes or not. But we do spend that. And that takes up, close to 10 to 15% of the total pool of dollars. When you think of...
What? 15% of administrative costs.
About that number on $4 trillion, that's a huge amount of money going into administration. We'll talk about that. For the remaining dollars, look, about a third goes into hospitals, about a third goes into hospitals and infrastructure-based care, about a third goes into physicians' offices and other clinic-type activities, and about a third goes into drugs. Again, simplification from that perspective. In the drug and I would add to that maybe drug and device category, I'm including the cost of pharmaceuticals that might be administered in a doctor's office or a hospital, right? So just think about it as a third. And that's how people can think about when I go spend my money or I go into the healthcare system and I'm spending money, on average, a third is happening there. Obviously, some people never end up in the hospital. Many, small proportion of people end up costing us a lot in hospitals, for example. Some people are not on any drugs. Some people may be on 5 or 6 drugs. The system has a variety of what I call cross-subsidies in it.
And just so that folks who are maybe thinking about other ways that they've heard this, because I know you've described it this way, which is it's often presented as half of the healthcare dollars are flowing into the facilities. One third of is going into payroll and physicians, and then 1/6 is going into drugs.
That's right.
But what the problem with that view, and the reason I like your 1/3 better, is it's more transparent, which is in the previous world where we say half goes into the facilities, we're discounting how much of that contains physician salary and how much of that also contains pharma. So when you strip that out, it's actually more elegant to point it out as 1/3.
The delivery industry is a pass-through to other things in some ways, right? Yep. And the 3-2-1 framework was probably an older framework. I mean, if you look at the rise of the total drug costs, which I'm sure we'll get into, the third is absolutely a more transparent and simplified way of looking at how we're spending our dollars.
Yeah.
Okay, this was only a part of a healthcare discussion between two medical doctors. But listening to it, it's amazing, the numbers and the way it works right now is unsustainable. It cannot be. Yeah, it can be because it's you guys in the US doing it, but wow. Well, yeah, I have to see more of this, but how are you gonna make this better? Because this doesn't work. This does not work for the average American. You hear it a lot on videos that I do, that it's unpayable. You cannot pay $1,000 a month on your health insurance, and then another 500 on your car insurance, and those numbers are incredibly high. And that's not how these work in Europe or, let's say, the rest of the world. This is crazy. But 1/5, 20%, 1/5 of the economy of the United States lives off the healthcare system. And if you want to make a change in that system, you're gonna tap on those big pharma bottom line numbers, and they will fight you as much as they can to prevent that you make any change into those numbers. So changing it can only be done if the public, we the people, if the public actually say enough is enough, now we want to make a change for everyone, otherwise we're gonna do, I don't know, yeah, but this is not good. This is incredibly insane how this works. Better said, how this does not work. Wow. Really, wow. Those numbers, it's incredible. It's incredible. Well, I hope you liked the video. If you did, press like. If you want to see more videos of me, then you can take a look at this video. And if you feel up to it, then you can press this button too to subscribe. And I will see you in the next video. Thank you for watching.